In this section, we'll look at Up to Date. Up to Date can be accessed from the Quick Links menu of CIAP. It's a US-based resource that covers in-depth content across a range of specialties. The content is structured around clinical questions that come up in practice. You can register for an account, and if you sign in, your CPD will be tracked while you're working on the site. This also allows you to do other things like bookmark your favourite topics. Up to Date supports natural language questions in its main search bar. If you have an account, you can search in other languages, but the topics continue to be in English. When you click the hamburger menu, you can see the main categories of tools and content types. Highlighted content on the main page includes the practice-changing updates, and these have graded recommendations that reflect the strength of the recommendation and the quality of the supporting evidence. What's new is also here, and you can filter by specialty. And these topics are a great way to stay current with emerging evidence and the latest recommendations that may affect your patient. They can also provide inspiration for education, for example, if you're presenting a journal club. The Drug Interactions platform is a highly reliable tool, and we recommend this tool to evaluate drug interactions. If I put in a few of our patients' medications, I can show you how the information is presented. So the matrix is along the top here, and we can see that there are two interactions to review. One is coded D, consider therapy modification, and the other one's C, monitor therapy. So we might need to look at that in a bit more detail. So this one has got some clinical significance because the serum concentration of the hormonal contraceptive may be affected and reduced, and contraceptive failure could be possible. So that would require some counselling with the patient. The other one, between St John's wort and fluoxetine, may increase the risk of some serotonin toxicity symptoms, so the patient would need to be aware as well as the clinician. We also have the patient education topics on the main page. These are also accessible through the individual monographs. The education comes in two levels, basics and beyond the basics, and all of the basic topics are available in Chinese, Spanish, Arabic and English and cover 4 or 5 main points. The top 400 topics are available in 19 languages. We also have calculators here on the front page. We can briefly have a look at some of the interactive tools. So we have up-to-date pathways, and although these don't cover adult topics, we can use one to show you as an example. If we go to psychiatry and have a look at the initial pharmacotherapy in adults, we can use this as an example. So you have the scope of the pathway. You can review the required tests if there are any, the exclusions, and then start the pathway. You can answer the questions and then you'll see the data populated on the left-hand side. So we're going to say that she does not have severe depression. She does have significant anxiety, and we now need to select the most important side effect to avoid. So if there were medical reasons, you may need to make that decision, but if not, then the patient's preference may be to select an adverse effect to avoid. So she may select weight gain. We're then given our options and some further dosing information, and we might select fluoxetine, for example. We're then given some instructions to use low-dose fluoxetine, and we can go ahead, say, if with that option or dose using another regimen, and then we need to review our assessment and plan. You can add some notes here, and then you can copy that assessment or print it or share it, for example. The other guided decision-making tool is lab interpretation. Our patient has low hemoglobin, so we can select that. And the first option you get is an algorithm, which you can work through to determine what you need to do next. There are other supporting documents along the side here, as well as background information. If we consider our patient Catalina again, we can search for abdominal pain. I'm going to select in an adolescent because of her age and see what we get. So we have the option to expand or collapse our results. In the expanded version, what we're seeing here are the most frequently accessed parts listed below the topic. We can always hover on the right-hand side and see the table of contents for each topic and see if there's anything relevant there. It's easier to review the topics of interest in the collapsed form. So we could see the causes of acute abdominal pain in children and adolescents, for example. And from here, we can also see the graphics without having to go directly into the topic. These graphics can be shared and printed and emailed, and they can also be exported to a PowerPoint. Some of them include videos, which can be shared as well. And that just makes it easy to review the topics. For example, we might want to have a look at this one about endometriosis in adolescents. It's always good to have a look at the review dates here. So February 25 was the last time it was updated, but it's current up to April 2025. And that wraps up our quick look at up to date. In this section, we will look at therapeutic guidelines. Therapeutic guidelines can be accessed from the quick links menu of CIAP. It is an Australian resource. The content is structured around these disease and condition topics, and that supports decision-making and safe prescribing. There are 21 guideline titles, and they are updated on a 4-year cycle. So it is important to consult other resources if the information is not current. What's new and updates are highlighted here on the main page, as well as these quick links to useful resources. The Drugs Index tab can be reached from this top menu and also from this button here. For our patient, for example, who's on naproxen, we might want to check some dosing information. We can quickly scroll through to the indication that's relevant, heavy menstrual bleeding. We'll be taken directly to the blue dosing information boxes. The ones signify first-line options. Here for naproxen, we can read across and see that the maximum daily dose is 1,250 milligrams. We might be concerned if she's taking 2-3 times a day, for example. If we choose to select a topic from the titles here, for example, toxicology and toxinology, we have the advantage of seeing the breadth of the topic and background relevant information. For our patient, if we were worried that she's taken too much of the naproxen unintentionally or deliberately, we can go through this menu and have a look at the NSAIDs. We can see how the topics are organised. It covers the risk assessment, expected symptoms management, etc. At the bottom, we can see the publication date. It's from 2020. So that wraps up our quick look at therapeutic guidelines. In this section, we'll look at BMJ best practice. BMJ best practice can be accessed from the quick links menu of CIAP. This resource is from the UK and is closely aligned to our Australian practice. You can set up a free profile, and then if you log in, your CPD will be tracked. The content can be explored from this main menu along the middle of the page, or you can use the main search bar and then filter. And important updates are highlighted on the landing page here. BMJ Best Practice structures its content around clinical assessments and disease-specific topics, and it directs you through step-by-step from diagnosis to treatment. It's the most important tool we have on CIAP for differential diagnosis. There are also some useful overview topics which I'll show you. So if we're thinking about our patient Catalina, we could use BMJ to explore possible causes of her abdominal pain. So I'm going to search for acute abdominal pain and zoom in so you can see it a little bit better. So here you can see the content that you can filter for on the left-hand side and then the topics on the right. The first few are coming up as assessment topics and then some disease and condition topics. I'm going to choose assessment of acute abdomen, which is relevant for Catalina. When you open the topic, I'll just show you that you can walk through the whole content almost from the front page and then using the headings up here. When we first open the topic, it's important to have a look at the review and update dates to assess for currency. The assessment topics stick to a few important subheadings. So urgent considerations and red flags, we might need to review those and see, check is, could Catalina be at risk of ectopic pregnancy, for example? That's just a reminder there. And the differentials, you can see that they're divided up into common and then more uncommon presentations. When you click on any of these, you are given some extra information, some history and other investigations that you might like to consider. You can also go through to the full disease and conditions topic. So if we wanted to exclude endometriosis for Catalina, we could have a look at that quick summary, but we can also click down here onto the full topic. The disease topics have more headings and include the treatment algorithm. This is really important. It steps you through both pharmacological and non-pharmacological treatments for your specific patient. So you do need to have a look at the subheadings and see in which category your patient fits and then what the considerations are for treatment. And these treatment algorithms on BMJ can be used as another source of high-quality pre-appraised information, especially when our Australian guidelines are outdated. It is worth having a look at emerging treatments for what's coming, what's on the horizon. Patients might know about these before you do. Other sections which are of interest if you're writing guidelines. The guidelines topic summarises international guidelines. The evidence tab is also really important if you're writing guidelines or for some tricky clinical questions. And you'll see BMJ will answer clinical questions and rate the evidence. And if you need help structuring clinical questions, they also show you how they've divided it up into population intervention comparison and then the outcomes. So that's a good place to sort of check against sometimes. There are also Cochrane clinical answers here if they're relevant. So these are authored by clinicians. They're 2 or 3 pages long and they give you the bottom line on a Cochrane published systematic review. So that was from the resources tab. You'll also find sometimes there's a nice summary as well. If we go back up to the main search bar and have a look at an overview topic, if we were concerned that she had a sexually transmitted disease, we can have a look at how the content is organised in the overview topics, and they're really summary, so you can sort of scroll pretty quickly and have a look and see if there's something that's consistent with one of these infections and then click on further to the disease topic or the treatment algorithm specifically. It'll take you directly there. So that's pretty efficient. And that wraps up our quick look at BMJ.